Queensland, and it's a beautiful day out there, and we've got the COVID update first, and then we're happy to take any other questions. So today we've had 7,311 new cases, and that includes 2,066 positive rats. Tragically, there has been 4 deaths reported overnight. 3 were in aged care, and from the outset, once again, can I please extend my condolences to the families who've lost loved ones during this time. We've had 24,875 tests in the past 24 hours, and in good news, we are now under the 500 people in hospital. So that's still a lot of people, but it is coming down, which really means we're coming off that wave. So I really want to thank Queenslanders for the great work they've been doing there. And the Chief Health Officer will give more information. Vaccine coverage, 92.34% at least one dose, 90.28% double dose, and boosters, 61.15% of the eligible population have received their boosters. And in relation to the 5 to 11-year-olds, 40.93% of children, and 3.5 million rats have been distributed to our HHSs across the state. And I've just been advised by the Deputy Premier that another 1.5 million have come in, which is also really good news. So look, I'll hand over to the Chief Health Officer and then the Health Minister, and then we're happy to take any other questions. Thanks.
Thank you very much, Premier. So sadly, we have 4 deaths to report today, 3 people in their 80s, 1 in their 90s. One of these people was not vaccinated, 2 had received a single dose of vaccine, 1 had received 2 doses, and none had received boosters. And of these 4, 3 were from residential aged care facilities, and our thoughts are with their families today. Importantly, though, the data that I find most useful in terms of tracking this pandemic is the hospitalisation data, and this is really taking a very positive turn. So we have 462 people in our public hospitals being treated for COVID-19. So just 19 days ago, we were at our peak of 928 patients. So in 19 days, we have halved the number of people that are in our hospitals. So clearly we're well on track to coming to the end of this wave of infection. There were 508 people yesterday in hospital. So at present, the number of people in hospital includes 44 patients in intensive care. That's in the public hospitals, 20 of whom are ventilated. In the private hospitals, we have 34 patients with COVID, which is up slightly from 30 yesterday. The other thing we're looking at very closely are infections in children. Given the schools returned on Monday, we're averaging about between 1,000 and 1,500 children diagnosed formally with COVID per day across the state, almost all of whom have very mild disease. Of those children, about half, roughly half, are in the primary school age between 5 and 11, and the other half in the secondary school age between 12 and 17. We're looking at we collect data on these children both from the collection of self-reported rats, and today we have 652 positive rat tests in children, which is down slightly from yesterday when it was 710. You might recall there was a glitch with the data collection from PCR testing yesterday. So today we report 1,113 positive PCRs in children. Yesterday it was 137, which was an underestimate. So what I can tell you is the average for the weekend is 625 positive PCRs, which is slightly up from Friday, which was 516 PCRs. So there's still no clear trend among children, but it is very early. They only returned to school on Monday. It would be a very big surprise if we don't see a significant increase in the number of cases in children in the next couple of weeks, but so far not a significant rise. I will remind you that we had substantially greater numbers of children infected 2-3 weeks ago, and we're actually at the bottom of that curve with children. So a substantial number of children will in fact be immune to COVID-19. So it's not quite clear what will happen to children in the next couple of weeks, but we do expect increasing numbers. So the basic summary is things are going far better than we had ever projected in terms of the COVID wave, this Omicron wave. So it's be interesting to see what happens in the coming weeks. I'll now hand over to the Health Minister.
Thank you. Can I also pass on my condolences in relation to those deaths that we're reporting today, the 4 individuals. Certainly I know it doesn't matter how small that number is, it's still a loss of life, and those families, I have no doubt, are deeply grieving right now, and our thoughts go out to them. It is pleasing to see our hospitalisation numbers continue to come down, as do the number of our staff that are positive and who are close contacts needing to be out of the workforce. So that all goes well to taking pressure off our health system, but I do remind that we still are managing COVID patients in these hospitals. We still are prepared for any person who walks into an emergency department could very well have COVID, and as many of the hospitals have reported to us, patients who are coming in for other appointments, other surgeries, who are being admitted are also showing up positive as well without realising that they actually had COVID because they weren't showing symptoms for that. Can I give a huge shout out to the parents and carers and guardians of the children that are coming forward and registering their positive rapid antigen test, or those who are being taken for PCR tests. We're very grateful that they're coming forward and getting tested and then isolating as a consequence. That means that we'll have less spread in the schools because parents are doing the right thing, and as soon as those children are showing symptoms, they are testing them and they are isolating, and of course so are the household members, and that all helps with the transmission. So I do remind people that our testing clinics are still available, and if parents do not have rapid antigen tests at home or do not feel comfortable with self-administering those tests, they can take their child to one of our testing clinics to get a PCR test by one of our health professionals. But we're very pleased with what we are starting to see with these numbers, and we ask people to continue to practice all of those rules around masks, social distancing, and of course getting tested if you have any symptoms. Thanks.
Any health COVID questions? No? Thank you, Dr. Gerard. Yep. Okay, happy to take any other questions.
Premier, did you personally refer the Integrity Commissioner to the committee over the two-year-old credit card allegations?
Look, let me start with a few facts. Let's get the facts on the table, and I think it's really important to get these facts so everybody is aware. I have a few things to say about matters raised today about investigations into the Office of the Integrity Commissioner. The first is that there are limits as to what I can say. Unlike others, I respect proper processes. I always have, and I always will. I'm not free to comment on matters currently under investigation by the proper authorities. That would be against the law. It would also be a contempt of Parliament. The Economics and Governance Committee has oversight of the Integrity Commissioner. When matters with her office were raised with me, I referred them to the committee. I did that based on Solicitor General advice. The Solicitor General advised me that that was the correct course of action, and that is the right thing to do. Didn't do it myself, I got advice from the Solicitor General. Certain matters relating to this complaint have been referred to the CCC, which continues its investigation. I think it would be helpful if the CCC could provide an update to the public on this investigation. I've asked my department to write to them to seek that update, but ultimately it's a matter up to them. Since the Fitzgerald inquiry, Queensland has had a robust independent bodies to guard against corruption, and one is the CCC. The other is our parliamentary committee. These committees are made up of all sides of politics, including at times independents. They do good work, including public hearings and evaluating new laws. This has seen to great effect during the debate about voluntary assisted dying, and most recently into allegations surrounding the Logan Council. The committees are constantly privy to confidential information, like some of the complaints that are reported today. It is simply not fair or legal to discuss publicly some matters before a committee, especially before that matters are completed. That is why it is unlawful to do so. I want to say this as well to the public. In this state, we play by the rules. We don't comment on court cases before they're finished. We don't comment on CCC and the committee business before they're finished either. I'm more than happy to take questions.
The paper's saying that the committee investigation and the CCC investigation into Dr. Stepanov have been concluded, and there was no finding of guilt.
I have to say that there are matters that are still not completed. So I think you can understand, Josh, that I actually need to respect those processes that have been put in place and that I have followed. I take my obligations incredibly serious as Premier. When I'm given Solicitor General's advice, I act on that advice. If I didn't so, that would be absolutely negligent.
But is there a bigger investigation here or a separate investigation to the Dr. Stepanov investigation?
There is a matter before the committee, and I can't comment on the committee, so you'll have to talk to the committee about that. I mean, it would be a contempt of Parliament. And some of the reports today have been selective reports from letters. So you'll have to talk to the committee about that.
Can you release the Solicitor General advice?
I can't, because it actually has the matters that were, details about the matters that were referred.
Can you release parts of the Solicitor General advice?
I can actually read part for you, which makes it very clear. It says, the Solicitor General, in my view, the primacy of the Parliamentary Committee's oversight role means that the committee is the appropriate body to consider whether allegations concerning the conduct of the Queensland Integrity Commissioner, regardless of the relative seriousness of these allegations and regardless of whether they constitute misconduct under the Integrity Act, warrant investigation. So I had to act on that advice. I had to act. I did everything right as Premier. I referred this matter for the committee's consideration. And what they do with that is a matter for the committee.
Who informed you of the allegations that you referred to the committee?
Jack, the issue is that if a matter comes to the attention, you have a duty to refer it.
Who brought it to your attention?
But that is irrelevant.
No, who brought it to your attention?
No, that is irrelevant.
Why
The matter was referred on advice. So the matter comes in, you get the advice from the Solicitor General, and that matter is then referred to the committee.
Premier, why did you air the referral in an estimates hearing? Apparently months after you'd already been informed by the committee, it had no role to play, and you knew the CCC...
Well, that's actually not correct. So your statement is not correct about what the committee said. You'll have to go back and get a full statement from the committee or talk to the committee.
With regards to the allegations that Dr. Stepanov has made in relation to the PSC, did you find out about those allegations before you made the referral of those other allegations to the committee?
No. So as soon as I became aware of matters, it is my duty to refer those matters. It doesn't matter, as you heard from the Solicitor General's advice, whether it's deemed to be small, medium or large. My duty is to refer it. If I didn't refer it, I would be in breach of my obligations as Premier of this state.
When did you find out about the allegations that Nicholas Stepanov has raised?
In relation to which issues?
The PSC.
Well, there's a lot of issues, Jack, and there are a lot of them that are actually under investigation at the moment.
When did you first hear about any of the issues that have been raised?
I'd have to go back and check, but the Solicitor General's advice to me was in April 21, so it would have been around that time.
Was it prior to your late subsequent referral to the committee?
Oh, sorry, this is just updated information. Sorry?
Was it prior to the subsequent referral that you made to the Parliamentary Committee?
I can't understand. So can you repeat your question?
The allegations that Dr. Stepanov has made, did you hear about them prior to your subsequent referral of the other allegations to the Parliamentary Committee?
All of the matters have been referred to the appropriate bodies.
So did you hear about Dr. Stepanov's claims prior to the referral of those other claims to the Economics and Governance Committee?
The only matters I heard about were the matters that were contained in my advice that was provided from the Solicitor General.
Well, why would you as Premier be involved in these? I mean, these seem like just workplace matters, aren't they, ultimately?
Because it's, as the advice says, as I'll read it to you again if you want me, I can give it.
I guess I'm curious why
because,
the Premier would be directly
Exactly, because the public service does not have the authority to investigate. The oversight body for the Integrity Commissioner is the Parliamentary Committee.
Wouldn't a minister usually take on this sort of...
The Integrity Act sits with me.
Premier, just back on Jack's question,
Yeah.
were you aware of the allegations that Dr. Stepanov was raising before you then sought Solicitor General advice and referred matters to other bodies, the CCC or the committee, about Dr. Stepanov?
Look, to my knowledge, no, but I'll double check. I don't know. I'll double check that, okay? I'll have to find out. But I'm telling you everything I can at this present point in time.
Can you see how the timing might raise some concerns, though, in terms of when you made the referral versus when Dr. Stepanov first made those allegations?
Look, these are matters that some matters may have been being dealt with by the public service over a period of time. They are probably matters for the Public Service Commissioner. Okay? So as soon as I hear of an alleged misconduct, I took immediate action. That is my obligation as Premier of this state.
And can we just ask him again, who brought to your attention those allegations of misconduct that you said you referred to the committee?
I have to say to you that I received matters and I referred them.
I know, but who brought it up with you?
I can't because I am bound by law. Okay, so I am bound by some legal obligations.
Was someone working in her office?
I can't say, Josh. I am bound by law.
Can you, without identifying them, can you tell us where it came from?
No, I'm sorry. There's legal issues here. I have to comply.
What legislation bounds you to make that confidential?
Jack, I can't disclose that either. I'm sorry.
The specific legislation.
I can't disclose that.
Do you stand by Dr. Stepanov at this present moment, given that you're saying there are still allegations hanging potentially over her or other people?
Look, I respect the office of the Integrity Commissioner.
Do you respect her?
Yes, I do. Absolutely. I have always found her advice to me, personally, very comprehensive, very timely. I have personally no issues with the Integrity Commissioner. But if any serious matters, any matter comes to me, it is my duty to refer it. It was up to the committee to decide whether or not they do anything further. But what I'm saying here today is it would be very helpful if the CCC would update the public on their investigation.
Well, why has it been nearly a year? Have they given you any advice on why their investigation has taken so long?
You'd have to ask them.
No,
I have no advice to that effect.
But what's your view on it, though? I mean, without reflecting on the investigation,
Yeah.
it seems an obscenely long time to look into a workplace matter of such high...
You'd have to ask them. I can't comment on their workings.
Did you at any point want Nicola Stepanov removed?
Never.
Why?
Never.
You have full faith in the job that she was doing?
Absolutely. I absolutely had faith in the job that she was doing, but when there are matters that come to my attention, I had to refer them, and I did that.
She revealed last week in the hearing in Parliament that she went from 8 staff to just 1. Did you know at the time that she was so severely under-resourced?
That's not my understanding. My understanding is that there was only a very short period of time, and it had to do with recruitment processes, so that's not my understanding. I can get that information for you.
When you said last week things could have been done better, was there anything about Dr. Stepanov and her dealings that could have been done better and how the government's dealt with it?
She's always dealt with myself and members of my ministry well. No, not in relation to the Integrity Commission.
So when you said that things could have been done better, you weren't referring to Dr. Stepanov?
No, I've addressed this at length, and I said very clearly that if public servants feel that they need to air their concerns, that we should have been listening more.
Do you think an independent inquiry would be an appropriate way for
Yeah,
allegations such as this?
We have a Royal Standing Commission
but that's
here.
That's subject to confidentiality, as you've alluded to. Would a public inquiry allow for these allegations.
But
to
the
be aired
Triple C
public?
can decide whether they do public or closed inquiries. It's the Standing Royal Commission. It's the Standing Royal Commission of this state.
Would you like to see them do a public
Be nice to have
inquiry?
one federally as well.
But just on that, I mean, you say
Wouldn't
they
it?
can. Would you like to see them do one publicly? Triple C?
I'm not going to comment on that. That is a matter for the Triple C.
Since last week that you encouraged people and public servants to come forward with any complaints,
Yes.
have any others been raised with you?
Not to my knowledge, Josh. I usually get updates. If anything urgent comes, they bring it into me, or the department actions it straight away. Yeah.
Just to be clear, you're still rejecting any call for a broader inquiry, public inquiry into integrity matters.
Look, can I just say, we have a Standing Royal Commission in this state. We have the Triple C. It is a Standing Royal Commission. They can investigate any of these issues, anything to do with misconduct, any allegations of corruption. That is why we have a Triple C in this state. Okay? All right.
Just one more question. Do you feel like everything has sort of come to a standstill? We've got the Triple C under its own inquiry, but you're waiting on the Triple C to investigate these types of matters. It seems like everything's hit a stalemate here. Is everything working?
Oh, look, I think there are processes, and people obviously want to get all the facts right as well. I think it's really important that all the facts are on the table. And as you can see, I've laid out very, very clearly, I have obligations. And there is a committee process, there is a Triple C process, and you either respect these institutions or you don't respect them. And I respect these institutions. I fought for these institutions. I mean, it was a Labor government that really have the hallmark of reforms. And unfortunately, the LNP votes against every sort of integrity reform that we've ever put in place. So that's a bit disappointing.
There's been multiple integrity officers, though, who've called for a broader inquiry. Why won't you listen to their calls, given they've made these calls on multiple occasions now? Why should the public believe your suggestion over what these four other individuals have?
Oh, look, I respect what they've had to say, and all of their matters are either being investigated or they have been investigated. And in relation to the archivist, we've got the QC looking at his issues. But let me say very clearly, we have a Standing Royal Commission. It is called the Triple C. You either support the institutions in this state or you don't support them. Now, I am very passionate. I understand my obligations. I carry out my duties respectfully every single day that I go to work. And I am following the processes. I've followed the Solicitor General's advice. I have complied with the law. And I try to do that every single day. So we either respect the institutions or we don't. And in relation to some of these matters, yes, I'd like to see them done a bit faster. But you'll have to put those questions to the Triple C. Okay?
Everybody have it.
Thank you.
Very much.